Hello, everyone, and welcome to the Operation Miss podcast, where we bring lovely people on to talk to our audience so that they can be equipped, women can be equipped to prepare and protect themselves throughout all phases of womanhood. And I am so excited to have my very dear friend, Dr. Rebeca Segraves, on today. She has to be one of the most beautiful women I have ever met. And when I was younger, I used to think that the women I grew up with would be the ones I was with later on in life. And what God showed me a couple of years ago is that you can meet people who you feel like you've known for a lifetime in your 30s. And I am so grateful. I feel like this whole podcast could be me thanking you, Dr. Segraves, for the love and kindness that you have shown to me, but also to the women I know, the women you know, the strangers that we've encountered over the past couple of years, because that's really what it takes to be the village that women deserve. And to have met you at this point in my life is a blessing, and I'm grateful. I'm grateful that you said yes to this podcast. I'm grateful for the first time that we connected and decided we would be connected for the rest of our lives. And I just wanted to make sure that I gave you that intro, because for me, being able to invite someone into my life as a friend at this stage of life is a blessing. And I want to thank you publicly for being my friend, for being my friend. Um, okay. Oh, it's our podcast crying. Okay. So let
Oh,
me ask you, let me ask you to introduce yourself. Your story is so beautiful. And so we're going to talk through parts of your story, but whatever you would like the audience to know about you in this moment, I would like for you to start with that. And then I'm going to tell you why I thought it was so important for you to come onto the podcast today.
well, thank you, Catherine. First of all, thanking me for friendship. I mean, to me, that this is such a mutual, deep feeling that I have about you, and there's no thanks necessary. It's just an embrace from me to you, and it's such a joy. First of all, to talk to you whenever I do get a chance, but then also to talk with your audience on your podcast. And so, thank you for having me here today.
You're welcome.
Who I'm so many things. I'm an aunt, I'm a sister. Most importantly, I'm the daughter of Linda Bermudez. When I think back really about the friendship comment that you made about having and finding those friends later on in life that feel like you've known them your entire life, I remember my mom just being always the one to be the person that you would call when you were sick. She was always counseling other women and talking about vitamins and minerals and golden seal echinacea and all these concoctions and herbs and things to help them, whether they were having severe pain, in terms of during their menstrual cycle, whether they were having issues with bowel movement, constipation. She was always cooking up something to be like, here's a way to get more fiber in your diet, but I know it's not easy, so we're going to make it easy. And so she was always the one that I would hear on the phone for hours with so and so, and everyone was our auntie. And so I think a lot of who I am just really comes from that, the love that she had for women, the love that she had for people, the healing capacity that she had, it just seemed unlimited. She had 6 children, all natural, no epidural, no medication, nothing, all vaginally. Um, and she was just a healer. And so when she lost her voice, she had a massive stroke. That was her superpower. Her voice was her superpower. And so I find myself speaking, I feel through her and through her love for people. So I feel like that really sums up who I am. I'm a physical therapist by profession, but I'm also just a lover of the capacity that we all have. to know and to treat our bodies as the temples that they were made to be.
Yeah. Yeah. Oh, that is so beautiful. So can you go back? You said that your mom had a massive stroke. Can you talk about how that impacted your journey to where you are today?
I think it has
That
really.
experience, I guess, in with your mom, and how prepared were you for that, do you feel? And if you learned anything along the way, can you share that with anyone who may be listening that finds themselves in that situation where they're either caring for someone who cannot speak for themselves, or they are that person who cannot speak for themselves?
um wow. I think my mother's stroke had everything to do with where I am today. I go back to that time. And so professionally, I had not gone to school to become a physical therapist yet, but I was in training. And so I was actually working in inpatient rehab with people and with families who had had a stroke. I was a rehab technician for an occupational therapist, for a physical therapist. So I thought I was the most prepared for when it was happening to my mom. And I think when I go back to like kind of the 2 or 3 day period around her stroke, I was not picking up that the medical team was withholding care because they didn't think she had insurance. And I wouldn't say that our family came from money. I mean, any of my family members would tell you we certainly did not, but we can scrounge up some dollars if we needed to. So to know that at that time she had the Cadillac of insurance, she had very good insurance coverage. They had not asked for her card. She was being treated as someone who didn't even have Medicaid, who was indigent. That's a term that I learned later on to describe a person who has no insurance coverage. And so we were in the holding room of the emergency department for hours before they would even give us a bed. They weren't running tests, and she was losing function. And I was screaming internally that my mom's not able to lift her arm. My mom's having trouble now standing. My mom can't walk without assistance. And I just felt like I couldn't get anyone's attention. And it wasn't until the last day where they were going to discharge her to a nursing home, everyone was surprised because the occupational and physical therapists were in the room. They were like, she should be going to inpatient rehab. And all of us knew JFK in New Jersey. Like, it was the rehab of rehab. It was a Cadillac of rehabilitation centers. And the case manager came in and said, no, she's going to be going to a nursing home. She doesn't have insurance. And I just said, what? And then everything clicked. I realized my mother was being treated the way she was being treated because they had already determined she couldn't afford, or she didn't have coverage, or all these things that you determine before you ask. And what I realized is later on through PT school, the content I had trouble with most, with what actually brought me to PT school, which was neurodiagnoses, stroke, people with spinal cord injuries, these people who had sudden terrible things that happened, and our ability to help them recover. The thing that brought me into PT school was the thing that almost took me out. I did so poorly. And I couldn't see another woman, especially a Black woman, after a stroke the same way. I couldn't control my emotions, right? It reminded me it was too close to home. So it actually really kind of guided me on a path towards women's health. And that's what I do now. I work with a lot of women really throughout the lifespan. And ironically, where cardiovascular disease affects us most, that actually ends up being a stroke or a neurological injury. I feel like my path is now in preventative care and wellness. So I really enjoy working with women either around the time of where we can really change things before they get to the point where she's had a stroke or she's suffering and her whole family is impacted. And so my mother's story, it just lives with me because there were so many things that we really could have done differently had I really been aware of the health system that we were entering in. It wasn't one that was built or designed for us. And I know that now, and I'm better equipped to help other people navigate that.
Yeah, I really hate that your mom had to go through that, number one. and that you had to watch it happen, and that last piece not click until she was about to be discharged, right? That is a disservice to us. This is a disservice to you, to your mom. It is really beautiful to see how you have used that to get to where you are today. One gap that I want to fill, because you said it, and I was in a room of ladies a couple of weeks ago, and I asked how many people in the room have had someone affected by heart disease in your family, and a few people raised their hands. But then after we started talking about what is on the other side of heart disease, or how heart disease can manifest itself, when I mentioned things like stroke, they were like, oh, I have, not realizing that the heart, wherever blood is not delivered, wherever oxygen does not get to, and that part dies, that is a cardiovascular disease. And so if we don't start really breaking it down so that people understand that everything begins and ends with heart health, then we're behind the eight ball, right? And so thank you for bringing that up, because for ladies listening, heart disease is the number one killer of women in the US. And so if we can just go back to the basics, get the definitions down that we should have known in elementary school, then we would be better off at the end of our lives. If we understood that once we get to menopause, and estrogen levels decline, or the type of estrogen that we're used to having in our bodies decline, because there are three types, and that third type is not as heart protective. And I think about what happens during pregnancy and why we probably do need a different type of estrogen at that point, and what's going on pre-pregnancy and why that type of estrogen predominates at that time. Then it makes sense that as we get a little bit older, we might have to adjust the way we exercise, the way we eat, the way we move, the things we do, how we sleep, how long we sleep, because the hormone change is going to happen. And so we have to be best prepared to show up to that space and protect our hearts, not make that be the time of our lives when we start challenging our hearts the most, without there being a runway to get there, right? And so thank you for bringing that up. Did you want to say something?
What you said about heart disease and the response that you got from the women in that room when you mentioned stroke, and the disconnect between people not realizing they're one and the same, it just happens in a different location of the body. That was exactly my mother's history. She had years of chronic hypertension. Her blood pressure on a good day was in the 160s over 90s. That's already blaring alarms for anyone in the medical field, to just be at baseline in your 160s over 90s, when the norm, quote unquote, the norm, and I say quote unquote because it's a norm in the textbook. It may not be a norm for you. Our blood pressures vary, right? But the norm is 120 over 80. And so the day before, and I'm talking about 24 hours before her massive stroke, we were in physical therapy. And I had actually come home from North Carolina to New Jersey because she was showing signs of vascular dementia. So we had already had a neurological consult, worried about her long-term memory, because she was already showing signs of behavioral change from having a high blood pressure, from that blood beating against her arteries. And so she had had knee pain that was preventing her from walking and getting a runway to where she could tolerate a little bit more activity, because my mother was sedentary. She just sat really most of the day. And we were trying to get her to just start a walking program. Her cardiologist recommended it. Her neurologist recommended it. And so I thought, well, let's address the knee pain, because she does have, arthritis. And the physical therapist, I kid you not, it was the factory mill of factory mills. And this is kind of what people, when they think of physical therapy, probably think of, is you go into an appointment, you're treated with 2 or 3 other people, and the physical therapist is going on between you all, if it's an outpatient orthopedic clinic. And that's exactly what was happening. I saw this person, this doctor of physical therapist, put my mother on machine after machine after machine when she had not exercised in years. And so
Right.
she's on the bike, she's on the treadmill, she's on the elliptical, and I could see my mother, and she's not speaking. That's another thing. My mother had a voice, and she's not speaking, and she's tired because you're putting someone through an exercise regimen and not taking their vital signs. Their baseline 160s over 90s. And so I was a hawk at home. I was a personal trainer taking her blood pressure, but yet in that moment, my voice had disappeared. I was afraid to step on this person's toes. Plus, I wasn't in PT school yet. So it was very like, I'm not going to say anything, but I could feel something was wrong.
Right.
And so I say that really for people to understand is that runway that you're talking about, that applies for everyone, but especially if you have issues with heart health that are not being addressed, exercise is not the answer. Someone monitoring you or teaching you how to monitor yourself and get to know your own your body is the runway, right?
Yes. Yes. Oh my goodness. And can we just pause here? If anyone is at home and they do not own a blood pressure cuff, or you do not take your blood pressure, please start doing it. For us, we recommend you take it every morning, just like you brush your teeth every morning, you just take your blood pressure every morning. When you're finished brushing your teeth at night, take your blood pressure at night. It is so, taking blood pressure is so quick, and it provides so much insight into how your body is doing. And so there's no losing just to taking your blood pressure. It takes you less time to take your blood pressure than it does to brush your teeth. And it gives you so much information, so much empowerment, because there are things that you can do. So, in terms of regulating blood pressure, just a couple of quick things: making sure that you're drinking water. Hydrating is very important. Blood has a harder time moving through the arteries if there is not water to help it along the way. And so that can help lower your blood pressure. Getting 7 to 9 hours of sleep at night, that helps to lower blood pressure. When you talked about exercising, I love what you said, because it has to be what your body can tolerate. Because when we exercise, our blood pressure has to go up. It's just what our bodies naturally do to meet the demand. And so we're not saying don't exercise. What we're saying is match the exercise to what your body is able to tolerate, because over time, it does widen the diameter of the artery. And so then you're able to have lower blood pressure over time. But in the immediate phase, that's not what's happening. And so if you already have high blood pressure, then that means your blood pressure is getting even higher. And if it's back to back to back, how it was with your mother, and she had never done that or had not done that in a long time, then you all listening, you have to think about it. We're forcing a heart to do something that it's not used to doing. So then it becomes inefficient or ineffective. And something goes without oxygen. And if anything in our body goes without oxygen, it cannot function. So if it happens to be the brain, then that becomes a stroke. If it happens to be the heart, that becomes a heart attack. And so we have to really start thinking, what are we doing to protect the people that we know and love? How can we use our voices? And one of the best ways is to just know their baselines. And to call providers out if they are not monitoring a deviation from that baseline and they're doing something that they know could cause a deviation, like exercise. The other thing that I want to mention is packaged foods that have ingredients that have PHOS in it. That will actually run up your blood pressure, just like frozen dinners that have a lot of sodium. And so if you're looking at the side of a label, and I'm talking about cereal boxes, chips, things that you might think, oh, they're not that bad. If they have PHOS in it, that is a unnatural form of phosphorus. And so the body will absorb a lot more of it than it actually needs. It's very hard on the kidneys, and it can cause your blood pressure to go up, because a part of the kidney's job is to regulate your blood pressure. And phosphorus is a pretty big molecule, just like protein is. And so if that's constantly in our bloodstream, then the body has a harder time managing it, and blood pressure is going to go up over time. So those are just 4 quick things that you can do if you're having issues with your blood pressure to try to lower it naturally. And then we also know that sometimes medication is needed, right? Sometimes it's needed as a bridge to having better blood pressure while we're implementing these lifestyle modifications. So I'm so grateful that you brought that up, because honestly, as a family member, it's not your job to tell a physical therapist what to do. They should have known that that is on them. But what we know in hindsight when we look back is, well, what if I had said something? You don't know what would have happened. We don't know. And so going forward, we just don't want it to happen to anybody else, right?
I think it was and is our job. I mean, I think that listening to podcasts like yours, I mean, I find that your audience is more fortunate than most, right? Because I just learned something, PHOS. I mean, I would not have known that. So now I have some more reading to do. But I was a personal trainer. Even as a personal trainer, I was not a doctor, a physical therapist. I wasn't certified to diagnose or to evaluate or treat anyone with a medical condition. But I knew enough to say, this person has a history of hypertension. I need to be monitoring their blood pressure while they're exercising. And so even with under my certification, at that time, it did give me a little bit more authority than maybe a family member who didn't have anything and who really is kind of at the whims of the medical system. And so that's why I say I only refute that point, is because for anyone who has any level of education, wherever or whatever that is, right, wherever you feel, and if you see something, you say something. I mean,
Yeah.
you hear that at the airport, all right?
Yeah.
You don't have to, you see it and say it, if you see it in the medical system, even loudly, say it even louder, say something,
Yeah.
call out what is wrong, because so many of us are at risk.
Right. No, I completely agree. And what I want people to hear is that it doesn't have to be that you know it. If it just feels weird, then speak up, because you may not even know what they're supposed to do. You may just say, my mom is looking really tired. She doesn't normally look like that. My mom looks like this is a lot on her. I know you have other people to see, but can you take a closer look and see what's going on? So even if you're not medical, I love what you say, even if you're not medical, you don't know what to say. Sometimes you just being physically there is enough, but sometimes it's not. Sometimes it's not. And so then the answer is to leave. If you don't know what to say, they're not doing anything different, then you go to somebody else. And that way you can see if your person gets better treatment or different treatment. And then you may have more words. But you're right, like podcasts like these, conversations like these can put tools in the hands of people. That's what this whole conversation is about. And so I appreciate you correcting me on that, because people should, regardless of what they know, feel comfortable, confident speaking up. And even if they're afraid, know that you will never regret speaking up, but you may spend a lifetime regretting not speaking up. Right. So, yeah, thank you. Now, I happen to know that you've also worked with women who have cancer, who have had cancer, right? Had mastectomies. Can you talk with me about, I don't know, maybe just some things that you learned in that area for anyone listening who may have dealt with or be dealing with breast cancer, know somebody who is? What are some things that you were able to help people with? How were you able to empower them in your role as a physical therapist, as a woman, as a provider? And what should we be on the lookout for as women? What should we be asking for?
Oh, absolutely. And that's an interesting story, because I was really more exposed to my aunt's breast cancer and her journey while I was in PT school. So when I was finding out that, okay, maybe I'm not the best person to be working with a population who has had a stroke or had a severe injury after years and years of chronic hypertension, that was just too close to home. What I found with talking to her was that she had um, at that time, it had progressed to stage 4 breast cancer. And later, she did pass away 3 months before I graduated, but I was extremely close to her, and just realizing that she also advocated for herself and caught things that her medical providers had not caught. I mean, she taught me so much about the disease and journey through the medical system from the patient's perspective before I actually got to learn it as a physical therapist and treating things on the back end that we hear about. And so that what she caught was actually a rare condition that wasn't associated with the chemotherapy that she was given, but it affected her heart and breathing. She was very active. My aunt was a master sergeant in the Air Force. And when I would visit her, we would do no less than 2 miles of walking, even on her worst days, right, with a cane. But when she started to breathe heavily, she said something's not right. And they tried to say was something, maybe related to radiation that she had, to her breast issue that might have like affected her lung or her heart. And
Mhm.
sure enough, it was actually related to the chemotherapy that was causing her to have water around her heart. And so, again, someone who not a medical background, my aunt was not, a medical professional, but she had to do so much research on her own. And I found that when I graduated, I started working with that population. The first 5 years outside of PT school was almost entirely women around the time of breast cancer, around the time of uterine cancer, where they needed a hysterectomy. And I found some of the most just astute people who were just on it. Like they knew their medication. They had time to really learn about their disease. And so I think even for women who are like, okay, that is not the story I want to tell, that's not the future I want to have, I feel like what I learned from them being in it was what I appreciate about our ability to do that now without that disease. To
Yes,
really just take time and just know, like, learn about your bodies. I mean, you said taking your blood pressure takes less time than brushing your teeth. So if we could do that twice a day, we get a pulse on what activity really is best suited for us, and we don't jump on the latest fad of doing this and doing that because everyone else is doing it either to lose weight or to do whatever. And that's what I think I appreciated about working with women, especially around the time of their cancer journey, was that they took the time to really learn their bodies and adjust to life. And I feel like we really have the capacity to do that now before something major like that happens.
absolutely. Wow, absolutely. So you talked about hysterectomies. And you are so first of all, I know that we're not talking about all of the articles you published and all the things that you've done really to impact the entire world, but I do want to talk about this because you have really advocated for women post hysterectomy, post cesarean delivery, and obviously in listening to you, you're on the front end of things, but you're also there in case things don't go the way that they expect on the other side. And so, what are you seeing? What have you seen with women post hysterectomy? Let's just say that post cesarean delivery, what are they not getting? And what should they be getting and advocating for?
They're not giving, I think, honestly, the first thing that comes to mind with your question is just dignity of 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 a recovery plan. I've
Mm,
never seen anything like it, Catherine, to be honest with you. I mean, I didn't even talk about my own surgical history with, like, my knee, which is very orthopedic for anyone, is like, you talk about knee surgery, everyone's thinking rehab. Who's your PT? What are they doing? And, you talk about your shoulder, you talk about your hip. Who's your physical therapy? What do they have you doing? You ask someone after a hysterectomy about rehab, they'll give you a blank stare. I've never seen anything like it. And it was my aunt who really kind of clued me into this, is that as an active person, it was unheard of, really, even with her. And in some instances in the military, they treat their their personnel very differently than our civilian hospitals. Like, she was given rehab. She had a hysterectomy and a mastectomy. And so when I started to really get into rehab after hysterectomy, to see women after 6 months, they had no rehab plan. They're loading and unloading the dishwasher. They're still trying to sweep. They're trying to vacuum, and they're in pain. And no one had even given them the dignity of asking, well, how much help will you have? How much support will you have? Who will be preparing the meals or cooking the meals or helping you clean or doing this or doing that or doing laundry, even standing up to take a shower? It's incredibly difficult for someone who's had a major surgery. And it didn't matter whether it was a very small surgery, even surgeons will go back and forth on me. Well, a vaginal hysterectomy is very different than abdominal hysterectomy. It doesn't matter. You're removing an organ. And it takes hours to do that and suture everything and stitch everything in place and make sure that you've left nothing in the way of making sure that person doesn't get an infection or making sure that person doesn't continue to bleed. So that is still a major surgery. And to not offer rehab, I think there's a lack of dignity in women's healthcare in general that I saw. And that was the first kind of like aha moment that I had about pelvic surgery in general. C-section, that was a major like aha moment. It was just a shocker. You just don't do surgery on someone's body and not offer them a way and a guide to recover the way that they want to recover. And so I think a lot of my work in advocacy has been on the front end, like you said, hopefully getting to those women before they even have the surgery so they know what to expect. They know what to do within the first week. They know what to do within the first 2 weeks, and then definitely within the first 6 weeks. Because right now, traditional standard of care, no one's even following up with you until 6 weeks. And so to me, that was the first thing to change. Right out of school, we started seeing women within the first 2 to 3 weeks at the latest
Yeah.
after a major surgery, like a mastectomy or a hysterectomy. But now we're moving that into the hospital so that you get that rehab evaluation before you go home. But I still feel like we need to be better. We need to be informing women before they even go into the operating room. And I think that that's where the dignity of women's healthcare has so much potential to improve.
I love that you said that. I remember a girlfriend of mine, she's a nurse, and when she was getting her knee surgery, she had prehab. And I'm a physical therapist just like you, and she had prehab. And I was like, oh, excuse me. She said, oh yeah, girl, I knew to ask for it. She had all the exercises and everything. Because we know after surgery, they're trying to, you are going to be made to leave the hospital within 2 days if you had a total knee replacement, right? Or within a day if it's a total hip replacement now. And you can't remember all of the exercises and how to get out of the bed and how to transfer into and out of the car and how to use the walker if you get sent home with, like, it's so much to remember. And so when she told me that, I said, oh, okay, everyone I know who's having knee surgery, I'm gonna tell them to ask for prehab. And if they say they don't know what you're talking about, move on to somebody else, because clearly they are not concerned about how you're going to do afterwards. They're concerned that you don't have to come back with an infection, like you said, but in terms of function, we've seen people who have scar tissue that's never been massaged over their total knee replacement, and they're told, that's about all that you're going to get back. We do the scar massage, we do water therapy, we do biking, and the person has full range of motion now. All they needed was a few more visits, maybe a therapist that will look at them through a different lens. There is always an answer to getting function back. You just have to make sure that you chase it down if it is not handed to you. And so I love what you said. I love what you said. We need prehab for hysterectomies. And the thing of it is, of course, when you talk about being upstream, I've met so many women who thought they needed a hysterectomy and they actually didn't. And so that's where I am. I'm just like, do we have to take all of the organs? Does everybody need their organs removed? Or is there something we can do from a lifestyle modification standpoint to help you not have that story? And so most recently, I was consulted because a lady that I met a couple of years ago had a hysterectomy. And she said, Catherine, I wish I had reached out to you before I said yes to the surgery. And when she told me her story, she is 40, let's say 41, 42. She was having a lot of heavy bleeding. She was told by someone that she just knew, a friend. They said, wouldn't you have a lot less on your mind if you didn't have to worry about those heavy periods? You might as well go ahead and have a hysterectomy. So she went in, talked to a provider. They were like, yeah, I mean, you already have a baby. You'll be fine without your organs. They take her organs. And she contacted me because she was having leakage, she was having pain, she was having all of the things that can come post hysterectomy that people don't talk about, people don't know about. And when she and the pain with intercourse. And so I asked her, well, what did last year look like? We hadn't talked in a couple of years. And wouldn't you know, her mom got sick, so she was a caregiver for her. She had a young daughter who was home 24/7, and she was still trying to work. And then her husband had a type of cancer, and he was waiting on an organ transplant. And so she was taking care of him. So he was no longer working. So you can imagine what her body was doing during that time. How in the world do you expect your hormones to really rebalance themselves when you're clearly getting no sleep because you're taking care of a newborn and your husband and your mom? Time is what she needed, not surgery, right? A plan. When you said the dignity of a recovery plan, a plan is what she needed. Maybe support, someone to help with childcare, someone to help take care of the house. And when she sat down after everything was said and done, she was like, if I had hired a housekeeper, if I had asked my parents to come and stay with me, if I had, so she walked herself through it once we talked, because you have to get past the fact that you didn't actually want that done. Now you've had it done. There is no turning that dial back. But what can we do moving forward so that you can give time to you, the time that you deserve, that you lost over the last 2 years? As women, yes, we want to care for our families, but we also have to make time for ourselves. Nobody is going to give it to us. And so I heard this quote the other day, and the quote was, make sure that your yes to someone else does not mean that you're saying no to you. And if as women, we could just embrace that, yes, we can say yes to a lot of people. But if we keep giving from our cup, we will never be able to refill it. And so another lady, she's a pediatrician, Dr. Chloe, she talks about the saucer and the cup. She had heard this quote as well. And she said that this woman was talking about how she's not giving from her cup anymore. She's going to fill herself so much that she overflows, and she's going to start giving from her saucer. And I thought that is what we need to be doing, right? Giving from our saucers and making sure that we take care of us. And I think that if we do that in our day-to-day practice, we're saying yes to us, then we have no problem saying no to a provider who will not say yes to our needs. We're not going to say, well, they're the people who live the closest, it's the most convenient, because we wouldn't do it for anybody else. We're going to go to the person who cares about us and takes us into account first. And so I hate that she went through that. But when I tell you how she's living now, with someone coming and cleaning her house a couple of times a week, her doing her pelvic floor physical therapy that she knows she needs to do. I mean, it's so beautiful. Her waking up and breathing every morning, and that starting out that way, taking her vital signs, exercising, just her life is different. And sometimes it takes us going through something, realizing that it was a mistake and saying, oh, okay, but I'm still in my 40s. So if I have another 80 years left, I'm going to live for me, right? I'm going to live for me. And so I want to go back to something though, because you talked about your knee surgery. And so I would love to hear about that. But I also want to know why you went vegan. Okay,
Oh,
because the other day you told me you were eating a burger, and I said, "Oh my God, a burger!" Years ago, and I forgot why we were even having that conversation. I could never imagine you putting a burger to your mouth, right? Just based on what I know about you, fitness wise, health wise, diet wise, or nutrition wise, because it's not about diets, right? It's about making good choices every day, and then deciding sometimes to veer off that path if we want to. But being unhealthy is not the norm, right? It is that we may indulge at some point, but health choices are our lifestyle. So can you tell me, how did you arrive at a vegan lifestyle?
yeah. And so the burger was actually plant-based. So it was mushrooms,
Sure.
quinoa. It was delicious. Yes. So anytime you hear me saying I'm eating a burger or a steak, it might be a cauliflower steak or some type of plant-based burger. But
Girl,
yeah,
finesse.
no, I'm 100% completely vegan. And it was that fear of having a hysterectomy. I am a patient who, because of my history, because of my aunt's cancer history, because of my mother's stroke history, I can't ever go with the first recommendation I hear. And so the first surgeon never has my commitment. The second surgeon did not have my commitment. I went to 3 OBGYNs before I found a fourth one who was a plant-based, I never heard of this before, an OBGYN who was a plant-based physician. So she was all vegan, had a whole kitchen adjacent to her office where she would teach her patients how to cook. And she did all her own appointments. This wasn't covered by insurance too. And they were all 1 hour, and she spent at least the 55 minutes face to face. I had never seen that. All my OBGYNs that were saying hysterectomy or let's do some surgery, let's see, if this is really, necessary to go to a hysterectomy. All those appointments were like 15 minutes, right? 15, 20 minutes that I actually sat face to face with the OBGYN and not nurses and medical assistants and other people. And so she sat me down, and I'm telling you, the paperwork to get into her office, it was all about, what do you eat? How often do you cook? How often do you go out to eat to a restaurant? Are you buying packaged foods? Are you buying shelf foods? It was so much about diet.
Yeah.
And at that point, I mean, I'd had heavy periods all my life, very painful, heavy menstrual cycles. I hated my period. I would miss school, and it was hard. It was hard on my mom. It was hard hearing that, they wanted to put me on birth control. So she would try all her concoctions that she would later talk to her female friends about, because they did start working. Like, I knew that from my mom's kind of upbringing of us, she really went the organic route and the herb route. And so being plant-based eventually and going that direction, that was the one thing that finally regulated my period. And that's not for everyone. I had to really, really work with a registered dietitian and really work on my diet, because it was not good. I was at least eating fast food once or twice a week, eating a ton of cheese, drinking a bunch of milk as a grown woman. I didn't think there was anything wrong with that. Me having milk at dinner. Um, like a large child. And I really had to change my mindset around food and what was I putting into my body, and did I need all those extra hormones? And I didn't. And so that finally regulated to where I only needed a small surgery, not a hysterectomy. And that was the turning point for me, because not every woman really does well having that organ removed. I've actually treated quite a few women who not only regretted it because they realized that was not the source of their issue, it actually didn't help. It actually either made them worse, or they were dealing with chronic pain from the surgery itself. And so that was hard. It was a hard lesson to see that, but I'm happy that I was involved in their care. And I had the wherewithal to keep asking and wanting a second, a third, a fourth opinion, until I found something that, yes, it was hard. I mean, changing my diet was not easy, but I knew I wanted to do that if I could avoid the surgery, and I was willing to do that. And I've actually been exposed to more foods, more cuisines. I love eating. I love food. I eat so much more now, I think, just during the day. I mean, I think I was on the phone with you a few days ago, Catherine. I was eating a bowl of cherries, and I was just in heaven. And I'm just like, I love the taste of food now so much more. But yeah, I mean, surgery is not new to me. It's not something I necessarily fear. I think I fear just the lack of preparation women especially are given after their surgery. And I had histories of surgery. I was born with one leg that was 3 inches shorter than the other. So a lot of history with that to stretch my leg, and a lot of physical therapy. But at least I knew after those surgeries, I would be given a recovery plan. After a hysterectomy, I was very, very fearful of what that could look like. And I've been able to avoid it for now.
Yeah, yeah, you did awesome at avoiding it. And I love the way that you talk about how much you can eat. A lot of times, because of what we eat, we're eating too much, right? We're eating too much. And we're eating on the plan that we grew up with because of school. So you wake up, you have to eat before you go to school, or right when you get to school, then you eat when they tell you to eat right before recess, and then you eat again when you get home. It is, and then most meals have meat. So if you, well, us growing up is interesting. I think about the way that my mom is Panamanian, and we ate oatmeal every morning. So we didn't have bacon, eggs, grits, none of the things that I was introduced to when I went to college, and that people talked about how amazing it was. And of course, when you try it, a bacon, egg, and cheese sandwich, oh my gosh, a loaded bowl of grits where they throw in the eggs and the bacon and they mix it up with all the butter. I was like, oh my goodness, what is this? And so college was when I got introduced to eating like that, right? But only a few years in, I realized, I was like, man, this doesn't it's like, it's one of those things where it's almost like it's magical because you finally get to try it. But then when I got out of college, I was like, I'm not doing this anymore. This is just, I'm eating what they fed me, just like I did growing up, but my mom fed us well. And we had rice every day. We did have a protein typically. Um, but it wasn't what I see people eating today, where it's that breakfast that we just talked about, and then maybe a hamburger for lunch, and then some type of meat with veggies for dinner. But that's the only veggies that you have throughout the entire day. But when you eat the way you eat, it's like you're eating, but the calories don't add up, right? So you could eat 30 cherries and you're fine. You could eat two whole zucchinis and squash. Like, we could eat all day and be just fine. But you shouldn't. When you said that we could be making these decisions outside of a traumatic situation, Rebecca, although I've never been an unhealthy eater, that's what I'll say. I was introduced to those things and I was like, oh my gosh, this is really cool. And I would eat them every once in a while, but never was it a habit for me. But what I'll also say is I didn't always check how did my body feel about the decisions that I was making. It wasn't until my bout with preeclampsia, postpartum, after delivery, that I realized I was out of control of my body and I had needed to get it back under control. So you wonder why about the PHOS? I had to learn, how do I regulate my blood pressure? Everyone says that the cure for preeclampsia is delivery. Well, the baby's gone, and I'm sitting here 6 weeks post delivery trying to figure out how to get my blood pressure under control. 8 months post delivery trying to figure out when are my kidneys going to heal, right? And so I had to learn so that I could get better, because nobody, while I had when I tell you I had an amazing healthcare team that I self-recruited, it was the dietitian, it was the pharmacist, it was the kidney doctor, it was everybody coming together saying, okay, try this, try this, try this. And at the end of the day, I had to try and then reassess and see, well, what actually works. We cannot just take the generalized recommendation, because while it is the healthcare provider's best guess, it has nothing to do with you as an individual. It is what they have seen over time, what research says is recommended. But if I put it into my mouth, when I tried the cardiac friendly diet, my blood pressure was still through the roof. It wasn't until I looked at the kidney friendly diet and realized that, wow, I'm still getting in too much sodium, too much potassium, too much phosphorus. I didn't even know that you could get in too much potassium, right? Like, isn't potassium supposed to be good for you? It's good for your heart. It's good for your muscles. It's like, it's hard on your kidneys. And so I learned so much during that time. And I am so grateful, because when you look at the research and they say that women who deal with preeclampsia are at a higher likelihood of having kidney disease, kidney failure 10 years down the line, the question is, have they been given a plan to do something different than they did prior to the preeclampsia? And 10 times out of 10, the answer is no. And so I made my own plan. And so I'm not plant-based like you, but I do eat meat, regular meat, twice or three times a week. I've found that my body likes that. I do fish on the days where I don't do the traditional meat. And I do a ton of fruits and vegetables, nuts, seeds, things I didn't eat before. Seeds, I'm like, seeds are for birds, right? I eat seeds now. But it's like, I know the value. But I had to run into postpartum preeclampsia before the light bulb went off that maybe I could be doing things differently, protecting my heart even better. Because as physical therapists, we're trained, right? We know to exercise. We know we need to hydrate. We know we need sleep. Nobody's really talking with us about diet, right? And so it was an eye opener for me. And I'm so happy, so grateful that I was 37, 36, 37 when I found that out, right? As opposed to being 67 and having to make that switch. So I'm
So
happy
much
you
harder,
said,
right?
go ahead, what'd you say?
It's so much harder to wait until you're like my mother's age. You know, she was 64 when she had her stroke. You know, we were trying to change her diet. And that's why I've always find it funny to just talk about diets, because once you tell someone what you're eating, they do like have this internal thing of almost reacting. Well, I don't eat that way. And it's like, well, your body is not telling you that you need to eat that way. You know, I was having heavy bleeding, you know, during my menstrual cycle and in between. And so my body was giving me signals I needed to change something. Your body, through preeclampsia, right, at 6 weeks after you've had your baby, right? And women are actually told, oh, once you have the baby, this should resolve. Like, and when it doesn't, then you haven't reassessed and tried something else. That's not evidence-based practice. When people talk about diets, that's not a signal for you to look at yourself and change. It's a signal for you to just look at your body as a whole. Is your body saying, we need to just reassess everything and then take into account that your diet is going to be different because your body's telling you something different, right? Or it could be something similar to another person, but you still have to have someone who evaluates you
Yes.
and then reassesses. Just doesn't give you a recommendation and walk away 3 months down the road. Oh, that didn't work. Did you reassess? Did you change something? And so evidence-based practice and research, when I hear all that, I hear there was a population that you studied, and then you took those findings and you generalized it to the rest of us.
Yeah.
Guess what? You're still an individual. And so you still tread carefully when someone is saying, well, the research said, well, are you looking at me, doctor?
That's
Were those people in that study? Did they look like me? Right? Were they my age group? Were they my background? Did they have the history that I had? All of those things to me matter so much in medicine. And if your needs are not being met, that is a signal for you to go somewhere else.
yeah. Oh, absolutely. Absolutely. And I love I love that you said that, because a lot of people, I think, don't realize that the recommendations that are being given are because of research. They don't have us in it sometimes. But what I will say is that the nutritional choices that people resist the most, I think it's more based on society than it is based on whether it works or not. Because my best guess for me was plant-based, and that's what got my blood pressure back to where it could have been, where it should have been at 100/60. So even though I've reintroduced some things, now I see my systolic a little bit higher. I see my diastolic, the top number, bottom number, a little bit higher. And then I'm like, oh, okay, backing off of that again. But I also know that when I assessed my minerals, you know how we do vitamins, everyone's like vitamin A, vitamin B, vitamin D, everybody's talking about vitamins. We need minerals. We are lacking minerals in this country, right? And we can get minerals from what we eat, but we're not even exposed to the foods that give us the minerals that we need. And that's what I'm realizing. When I looked and I did my mineral panel, I just for a week looked at the things that I was eating and what I was getting, what I wasn't getting. And one of the things I had zero of was zinc. Zinc. Our bodies need zinc. And I was like, okay, well, while I'm looking for a veggie that gives me zinc, I'm going to go ahead and introduce a little bit of meat, right? Because I know it has zinc. And so that's where I got to the 2 times a week to have meat. I need zinc in my body. And it's like it's so fun to assess and reassess. That's what we do as PTs, right? We want to see, did our intervention work? And so as an individual, I love when I tell you waking up and taking my blood pressure and it confirming that, yeah, what you did yesterday was great, or waking up and taking it and it looking like, no, what you did yesterday, I didn't like it. How much better is it for you to get that feedback day to day than it is for you to wait a year for your annual physical? And when you talked about your body, your aunt knowing her body, I think about it. How easy is it for us to check our breasts in the shower? Know what your breasts feel like. We take a shower every day. And so these are things that we're not saying add this on to your normal routine. You're washing underneath your armpits. Just go around your breast. Okay, go around the other breast. We have to know our bodies. We have to know ourselves. That's what gives us the ammunition to advocate. And I think that that's what we miss as women. When we are saying yes to providers all the time, even when something doesn't feel right, it's because we don't have any evidence to show them. And so it makes us want to silence ourselves, but we still shouldn't. We just have to chase down the evidence and then bring it back or bring it to somebody who's going to help us investigate. Saying yes to the first person is never the answer. We wouldn't do it in marriage. And so why are we doing it in healthcare? I don't know. I think it's because we think the options are slim, right? When you see a girl who settles, it's typically because she's like, I don't think there's anything better out there. That is not the truth in healthcare. There's always somebody who is willing to help you. But when you said you had to pay for that OBGYN, that plant-based OBGYN, you know how much money she has saved you over time because you invested then?
So she was covered by insurance. I honestly, I don't know how she was running her
Oh,
practice giving 60-minute evaluations, 55 minutes face to face, and
wow.
going through that in depth. And I had to chalk it up and I said, well, maybe she's a doctor of osteopathic medicine and they just operate different than medical doctors. I learned a lot from her, but I realized, wow, she took my insurance,
Gotcha.
and every doctor just didn't compare. So now I do pay cash to see a primary care provider, a cash pay based provider, because I'd rather have that level of care than anything else.
Yes.
And I'm still chasing, and even no one really compares to that doctor, but I figured I can at least try to get something close to that. And a lot of the cash-based providers do spend that kind of quality time and you get to know them. And it's so funny that you actually said that about marriage. We wouldn't say yes to the first person who asked. So why would we say yes to the first doctor who prescribes something and we're not fully aware? Because at
Yeah.
the end of the day, you're responsible if that doesn't go as planned. And not just responsible medically, because it's always on their license, obviously, but you're responsible because you're bearing the burden of either a good medical plan or a bad medical plan. You're
Yeah.
bearing that responsibility. Your body is bearing that. And so don't do anything that you don't understand. And Susie Orman says that. That's, financial guru that I started following because of my sister. But don't make decisions that you don't understand. And that holds true in medical care, in your own healthcare.
It does. It does. And I think so we met a woman a couple of weeks ago. She was referred to us and her blood pressure was high, but she didn't know it. She just checked it because we asked her to, because of something that we saw on the dashboard. And when she checked it, it was 190 over 109. And she was like, oh my gosh, I know, I know. And she was on a medication. So she was like, her assumption is that if they put me on a medication, must be working and I don't have symptoms. And so why would she check her blood pressure? Right. And so the good news is that now she's on a different medication. But what I want people to hear is just because a medication is supposed to do something, that doesn't mean that it's actually doing it. And the great thing is that we have enough tools in our toolbox to check up on it, right? It's like if my kids say they cleaned up their rooms, I can always go in their room and check. And so I'm just thinking about carrying that over to our own healthcare. She didn't realize that the medication she was given didn't work and her follow-up wasn't for another 2 months. So can you imagine her being at home with her blood pressure that high with a newborn, going back to work during that time frame? Immediately when that happened, she got an appointment. But when she looked online, there wasn't one. There wasn't one. And I said, well, no, you got to pick up the phone and call and tell them what's going on so they could bring you in urgently, because our default is to look at what's convenient for them, choose the next available date, and then move on. These online scheduling systems are killing us. We have got to pick up the phone and ask for what we need. And so now her blood pressure is running 130s over 80s, 130s over 70s. And so we're trending in the right direction with the right medication, with the lifestyle modifications. And the hope is that she doesn't end up needing it anymore. We don't have to stay on medications just because we are put on medications, but we do have to make lifestyle changes, manage our stress, make sure we're getting sleep, hydrating well, exercising appropriately so that we don't depend on the medications forever, because medications are a band-aid. And when you talked about the difference between an osteopathic doctor and a medical doctor, or doctor of osteopathic medicine, I just talked to one the other day and she explained to me that the two terms, I guess, don't matter, but a medical doctor is trained to treat symptoms, where an osteopathic doctor is trained to get to the root of the problem. And so they're treating the root, right? And so that's what we want. If we can get someone who will treat the root of the problem, then we'll be better long term. And so if that's all you do in listening to this episode is you decide, okay, I'm going to go from someone with the MD behind their name to someone with a DO behind their name, if possible, then you could start there, getting a second opinion or a third opinion about what you've been told, and then see if their attempts at improving your problem fits better with your value system and with what you're able to do than someone who gives you a medication to fix it as the first and only option. So Yeah.
I it's oh man, when you I'm gonna just repeat what you said just for my own recollection, okay? A medical doctor is trained to treat symptoms. Doctor of osteopathic medicine is trained to treat the root of the problem. When I think about my mother's hypertension, I felt like every doctor was hearing the fire alarm, same fire alarm we were all hearing, and they were turning it off, right? Without actually seeing what is causing that fire alarm to go off, right? And so
Yeah.
when I learned about kind of just different approaches in medicine, I think I've been on a path to find who treats the root, but I've not heard it put that way between the medical doctor and the doctor of osteopathic medicine. So I'm glad that I'm learning, honestly, Catherine, more from you in this one conversation because it's like inherently I know this is not the person I want on my team, but I only know that much just because their approach just seems so surface. So that's when I just know to get up and walk away. But when I find that person who is going to the root and asking me about my sleep and my stress and my relationships and my food and my and how I prepare that food, I know this person is getting closer to the source. This is
Yeah.
the person I want on my team. It's hard to find, but to me it's worth it. And I find that in healthcare, it is almost acceptable to be silent, be a silent partner in your own healthcare journey. I've never seen that in any I've seen people go, toe to toe with a mechanic about what needs to be repaired on their car than their own the human body. In
Yes.
healthcare, I've never seen it's so acceptable to be a silent partner in your own healthcare journey. That just blows my mind.
Yeah. Yeah. You know, it's scary, but it is also, I think, the way society has been set up to where people who don't have medical training feel inadequate in and they trust that other people know better. But I do believe that as we move more towards learning ourselves more and we start to look at ourselves as the expert and we pick up on nuances, like when you said, it's how the food makes you feel. That's a part of it, right? How does the food make you feel before you put a cup on, before you monitor any other sign? Are you breaking out? Do you notice that you have any allergies, any bumps coming up, any hives? How does it feel when you swallow? How do you feel from an energy perspective? Do you feel heavy or do you feel like you could go out and run a marathon? Like once you start picking up on that, or on the weekends, I feel really sluggish, but during the week when I make my lunches and do meal prep, I feel better. It is an empowerment that I believe will carry over into the way we do healthcare as people, as just lay people, because we will know more about ourselves and have more to communicate. And then I think that that will also help people, healthcare providers, do their jobs better as well, because now they don't have to ask us all the questions. We're coming with all the answers. And if they're intimidated by that, we can move on. Right. So earlier, and we'll wrap up soon, but earlier you talked about getting PTs in the hospital, PTs in L&D. You mentioned that. And so I want to know what would a PT do in the labor and delivery unit? Can you talk to the ladies now who may be considering having babies, they're about to deliver? Why would they ask for a PT or an occupational therapist to come into their hospital room before they even leave the hospital?
Oh, right. And that kind of gets into a little bit postpartum recovery, but you know who probably demonstrated this the best was you, Catherine. And this story has been shared publicly, so I could say her name, but my very best friend from diapers, Pam Daniels, my cousin, really, we grew up together. Her mother's name was Linda before she passed away. My mother's name is Linda. She was having her second baby, and her first baby was born September 2020. So it was at a time where she was able to have one person in the room with her. But as soon as that person had to leave, which was 3 days after laboring, she labored for 3 days. And her friend said, I'm sorry. I have babies at home. I actually have to leave. Like she was in the hospital with her, staying overnight. And it just got to the point where she couldn't stay any longer. And they made the decision to do a C-section at that point. So she had a C-section alone in the hospital. And over the phone, I walked her through her recovery because I was treating in a hospital on the maternity unit as a physical therapist, working with women who were about to be sent home with no instructions on how to get out of their bed, no instructions on how to protect their incision. They were in 2 to 3 level apartments. No one had talked to them about going up and down stairs after a major surgery. And there was my friend in New Jersey. I was practicing in Texas at that time, and I couldn't get to her. So we went through her whole recovery, and I called the hospital, got into the rehab department, and had a physical therapist come to her room before she went home because she had 14 to 16 steps to go up and down. So, like, that's advocacy, right, for your own family member. But yet, this is happening every day where women are still sent home after a major surgery. And I already talked about the just how unacceptable that is to me. But during labor and delivery, you were helping Pam when she was now having her second baby and having the trauma of that C-section. She told me, Rebecca, I don't want another C-section. So we got her a doula. We got her another friend that came down to be with her in the hospital. We had this whole support system. And during that 3 to 4 days of where she was laboring, they were doing everything they could, despite having her whole team there and her doula to be like, you need this. We need to get you on Pitocin. This epidural, we need, it can't be a walking epidural. You're not going to be able to move. The epidural had fentanyl, and we both didn't even know that that was actually affecting the baby's heart, and blood pressure. And they were telling her, no, the research says it has no effect. All of this, I mean, just refuting every single thing. We stayed on the phone. I want to say you, Catherine, you were a force to be reckoned with. And I advocate for occupational and physical therapy to be on labor and delivery only if they have your knowledge, only if they have your level of just wisdom and knowledge of medicine, and not many of us do. And so I've kind of gone back and forth on who really needs to be part of your care team with labor and delivery, because I do advocate for doulas. I do advocate for rehab providers, but I see a silence that even happens with us. We're silent partners, not speaking up and advocating because we don't want to step on toes. If that provider is leading this person down a path where they will have an unnecessary C-section, they were telling Pam that her placenta was dried up. That her placenta, which is the largest interface of blood flow between the baby and the mother, was drying up, and it was further from the truth. She had a successful vaginal delivery. You were on the phone. I was on the phone. She delivered that baby vaginally. She says she breathed the baby down just like Catherine told her. She wasn't pushing. She had maybe a tiny tear, and she was up and walking within a few days, um, around the house, just doing kind of like what she could do and just feeling great. And her placenta was not dry. Okay. When they took that thing out, it was not dry. It was further from the truth. And so I don't know what really, honestly, Catherine, when you ask me about occupational physical therapy, we're going to need some soldiers. We're going to need some medically informed soldiers who are willing to speak up. And I don't think from just their training, from the same training we all went through, that they're being graduated and equipped to really serve as a mother's advocate on the maternity unit. And doulas don't have that level of medical knowledge that you had to be able to say, you're going to have to switch this epidural. I want one without fentanyl. And we were able to get the anesthesiologist, who was unwilling to do it, because we said, we don't want that. And sure enough, baby's heart rate was fine. It calmed down, and she was able to deliver later on that night. So I don't know, Catherine, what's needed, but I do know that the level of education that you bring to women's health, to maternal health, that needs to be a standard. And then that provider who has that level of education, whether it's a doula, who's a birth professional, and really an important support and advocate on the birth team, they still should know what moms are being told so that they can really support and give the best support and informed choice that the mother should have. And so should an OT and a PT and a nurse. I just feel like the standard that you bring really sets the bar higher for all of us to really evaluate what we're being told and who's on our care team to fight for us when we can't speak up for ourselves.
I appreciate that. I appreciate that so much. And I think honestly, it's a marriage, right? Just like we want there to be a marriage between a medical doctor and the patient. And I don't like that name, that term patient, medical doctor and the woman or man, right? I think it's the same with PT and OT, right? Because there are skill sets that PTs and OTs have that can help someone know how to get out of bed, maybe if they need an assistive device to go home, how to best carry their baby, how their posture is when they're breastfeeding or bottle feeding. And then there is that person speaking up for them saying, okay, themselves saying, okay, yeah, you walked me up these stairs. I know I did what you said I needed to do, but I'm really short of breath. And then it takes that PT saying, okay, let me monitor. Well, or prior to them having to give that feedback, saying, let me monitor their vital signs and then document it so that the person is not sent home in an unsafe manner. I think the more eyes, the more people that can come in and see a person while they're still in the hospital can potentially prevent them from leaving in an unsafe way. And so I appreciate you so much. I appreciate this conversation so much. I would love for you, as we close, to tell me if you had a vision for women's health from beginning to end, from when they're born from when we are born to the time that we die. What should be inserted anywhere along the way, everywhere along the way, so that we can navigate life better? What few things would you say that women should have, let's say in school, before they have their periods, maybe before they consider having children, if they want to have children or not, and then maybe into menopause? I don't know. Do you have a vision for that? And if yes, please share it, and then share how people can find you.
Yeah, I mean, I think that my major vision, especially for young women before they start their menstrual cycle, is really communication and leadership training. And I think that that's kind of missed in women's health, but is so important. This whole conversation was really talking about self-advocacy and being able to speak up when something's not right. I mean, I started out with my own mother's story. Here I was, someone who should have spoken up, but I lost my voice. And I feel like that's actually a trained, like, component just of who we are as people. Like, that has to be trained. It has to be nurtured, just like a muscle that you want to build and make stronger is your ability to communicate when you don't feel something is right. And I think all young women should be trained and taught and nurtured in communicating when they believe something is not being right, that is happening to their bodies. That
Yeah.
is women's health. I think that would solve, probably, honestly, I'm going to just say it, 75 to 85% of the problems we experience in women's health is not what the providers are doing, but it's our lack of ability to speak up.
Yes. Yes. Oh my gosh. Okay. Okay. It You dropped the mic. You always do. Can you tell people how to find you if they want to
Yeah.
connect?
So I'm the founder of Enhanced Recovery After Delivery. So we are training providers to speak up and to be part of the maternal care team, to just be there for women and their families when they're going through birth, when they're having an unexpected surgery, like a hysterectomy at the time of delivery. And so Enhanced Recovery After Delivery, you can find me in connection with that program and that effort, and really just advocating for women's health in general from the time of birth to earth, to the time that we close our eyes. And this has been wonderful. Thank you so much.
Thank you. You are such a joy and such a gift. I want to say this on record. You are a gift to the world. You are a gift to maternal health, and you are a gift to me. So thank you. I love you.
I love you, Catherine. Thank you.